Dr. Katrin Jahn,
Yeah.
thank you so much for joining me. I really appreciate this.
My absolute pleasure. Thank you so much for inviting me.
So I don't normally do this with guests, but I think you're an exception. So can you list for me what are your credentials? And that will, I think, give people pretty good indication what we're going to talk about.
Okay. Yeah. So I'm actually a recently double board certified specialist in veterinary psychiatry, which is also known as veterinary behavior medicine. But veterinary psychiatry is probably a more accurate term because it kind of indicates the way that we practice in terms of using medications and sort of the holistic approach that we have to treating mental and emotional ill health disorders in pets.
So it's such a unique conversation.
Yeah.
And I'm sure when you go to dinner parties, people are obsessed with finding out how you got started and what it is that you do. So to give people a kind of the foundation of the story that we're going to talk about, how did you get into focusing on, I guess, the mental well-being of pets?
Yeah. It's an interesting question, and there's a bit of a backstory to it. So when I was 4, I went to hospital just for something super regular, umbilical hernia repair. And that memory stuck with me as being one of the most, I'm going to say traumatic, it's a big word, but kind of an unpleasant experience. And it wasn't for any sort of physical reason, but that was like back in the late 70s. The separation from my parents, being in an unfamiliar place, and having, I guess, kind of a little bit of a non-consensual handling really stuck with me. And then when I opened my own practice, which is here in Abu Dhabi in 2008, I suddenly realized that a lot of our veterinary patients experience something very, very similar. So they also get separated from their caregivers. They also, I guess, are in unfamiliar environments, and they also experience handling that they maybe don't consent to. So that got me started down the whole path of becoming a gold standard cat-friendly clinic first and foremost, and then a fear-free practice, and then I started my residency. So I realized that we're really great as a profession of taking care of the physical health of our pets, but not so much of their mental and emotional health. And I wanted to change that. So that's when the residency started, and that was in 2019. And that culminated, last year and early this year in my exams.
So a couple of questions. First, how did you figure out, because I'm sure that there are some detractors out there who don't necessarily believe that there is such a thing as mental health when it comes to pets, animals. What made you think that there is something there? Because what you would have gone through, I'll be blunt, you're a human, they're an animal. How can they be going through something similar to what you went through? So what was it that sort of triggered something in you to make you think there are some pets that are probably going through something similar?
Yeah. I think the most important part is body language. So reading their body language and their behaviors in the veterinary clinic. So we kind of, I guess we talk about the veterinary clinic a little bit separately to maybe behaviors that pets show at home. But certainly in the veterinary clinic, and it was my own clinic, and I was really kind of, I guess, especially mindful that I wanted to make sure that the pets there felt okay. And so seeing some of the behaviors and seeing some of the body language and realizing that there were behaviors that were indicators that all was not well. That was perhaps the first thing. And then that was all backed by research as well. So we have quite a lot of research to show that something like 8 out of 10 dogs that come into the veterinary clinic show significant signs of fear, anxiety, and stress. For example, when they're lifted onto the examination table or things like that. And I think just the more time that I spent with those pets, the more I just kind of felt it to be true. And then, of course, we got a lot of evidence to back that up in probably the last 10 years, I would say, with the fear-free movement. And it's just become much more widely recognized. But I think when you spend so much time with animals and you get experienced at reading them, that was sort of the thing where I was like, oh, hang on, this pet isn't necessarily comfortable. There's something there. And I think fear, anxiety, stress, panic, conflict, all those sort of things are things that we can pick up on through body language and through facial expressions, through behaviors, defensive behaviors, becoming aggressive at the veterinary clinic because they're so scared. So those I think were the sort of the main indicators where I was like, well, there is definitely something here.
I think that when people have done their job for any length of time, they do start to develop instincts. And I think it's interesting when you talk about there is science now to back up what you're saying. when you need to go and get certification, what is it that you're studying? Because I'm really curious about this, because you would have been studying something that was in its infancy. And again, you have your instincts, but instincts in science can sometimes not be 100% in alignment. So what is it that you're studying when you're getting double board certified to learn more about the mental health aspects of pets?
Yeah, that's such a great question, especially because I've just been through the exams. So I have it all fresh in my mind. A lot. And it starts with things like ethology and, observing animals in the wild, for example, understanding the difference between predator and prey species. So looking at natural behaviors and how they translate into a domestic setting. So those are some of the things for sure. Then looking at kind of neurobiology, so what actually happens in the brain. So there's a lot of evidence there. And some of it is extrapolated from the human field. We extrapolate a lot from pediatrics, from human sort of child psychiatry, if you like. So that is a big part of it, understanding how the brain works and how things like hormones influence behavior, how neurotransmitters are involved. So that's a big part. And then from that comes, how can we use medications such as, human psychiatrists do as well? How can we use medications to help our patients to alleviate fear, anxiety, stress, help with trauma cases, that sort of thing? So psychopharmacology is a massive piece. That was one of the biggest areas, I guess. And then the other really big piece is how does physical health influence mental and emotional health? Because we know that there's such a big connection between physical health, mental and emotional health in humans as well, and things like the gut microbiome. So, how does gut health influence how we feel? That's a massive piece. So, and pain, chronic pain, that's a huge piece. How does pain influence behavior and emotional state? So those were some of the main areas. But then also things like, so we learned a lot about, as I mentioned earlier, those species differences and how is a cat different to a dog, different to a cow, different to a horse, for example, and what can we learn about those species-specific behaviors and what we need to supply to those animals that live in such close proximity to us to be able to sort of meet their behavioral needs. So that's it in a nutshell. It's a lot more, but yeah.
I bet it is a lot more. But so that when the animal is coming in for a checkup, say, and there's some apprehension that you can pick up on, is your job to look at making sure the animal is feeling more comfortable there, or are you noticing something that maybe a long-term issue that maybe the owners haven't picked up on?
Yeah. So I think both. I think, the other big area that we focus on are behavior problems in the home. So aggressive behaviors towards family members, cats peeing outside the litter box. That's quite a common presentation. And sometimes we see those exacerbated in the veterinary setting. So if an animal comes in for a routine checkup, there might be certain things that maybe alert us to that there is a bigger problem or a wider problem, a more chronic problem. But one of the big challenges that we have is that in those, let's say, 15 or 20-minute appointments when somebody comes to the veterinary clinic, caregivers are often not that forthcoming at actually saying, oh, and by the way, my cat's peeing outside the litter box. So something that we're working on is actually things like questionnaires that we give to caregivers when they're waiting for the vet appointment to try and understand, is there anything going on in the home? And is there anything that we can address there? And how might that impact them? And how are they feeling in the veterinary clinic? So it's sort of two sides of the same coin. And we may or may not see that exacerbated in the veterinary setting. But yeah, for sure, I think there's a lot more work to be done around using veterinary visits as kind of red flags for something going on in the home as well.
And then the long-term care involves you or one of your colleagues working with the owner and the pet, or is it giving instructions to the owner and then they are tackling these issues with their pet?
So the veterinary behavior consultation is actually quite unique. So it's usually a really long consultation, so anywhere between an hour and 2 hours. So we dive deep into what's going on. And then it would be, sorry to interrupt, it would be you with the owner and the pet. Yeah, exactly. Myself with the owner and the pet, or it could also be done virtually. So that's an option as well. So sometimes pets don't want to travel to the veterinary clinic, or it's, really stressful for them to.
Or they know the only time they're going in the car is when
to go to the vet. Exactly. And for cats, it's not really suitable to have them in the veterinary clinic. So a lot of that is done in a home visit or via a virtual consultation. But essentially, yeah, it's myself, the owner, and the pet. And if the pet isn't there live, then we'll see videos of the pet. So the caregiver will send in videos. And then we go through the whole sort of history, behavioral history and medical history as well. And we come up with a diagnosis because it's really important that we establish an actual diagnosis. And then based on that, we co-design a treatment plan, because there's no point in me suggesting something that then the owner can't implement or doesn't want to implement. So we kind of co-design a treatment plan, and then who's involved in executing that treatment plan depends on the individual case. So I will do a lot of environmental management advice. So what can you do at home to kind of do things differently? A lot of it is client education, actually recognizing those body language signals, things like that. I may prescribe medications if it's necessary. I might suggest that we need to do some other medical checkups, maybe a pain exam. And then we sometimes bring in, I'm going to call them trainers, but that essentially work on that learning piece with the pets. So often it'll be kind of a multidisciplinary approach. It'll be a collaborative approach. Myself, the pet owner, maybe other professionals. Maybe we need to get another specialist in, maybe a neurologist to have a look at something. So that whole sort of team approach is something that's really important, because these cases are complex usually.
So a couple of things that I want to dive into there. When you talk about medical history, sometimes, especially in the UAE, I don't know if it's more common here or not. It feels like it is, but I could be wrong. But there are a lot of abandoned pets. And so there are a lot of opportunities for people to adopt. Where do you fall on the issue of going to a breeder, getting a 3-month-old, as opposed to adopting an animal that may be 2 or 3 years old?
That's a great question. So I think there are a couple of things to think about. So if you're getting a puppy or a kitten, right, a 2 or 3 month old, you have a lot more influence maybe around that sort of early socialization period. So that early socialization period in puppies is up to about 4 months of age. So you may have some more influence there. You might have some more influence around early learning, but many behavior problems are rooted in genetics and epigenetics. So there are things that you can't have influence on. So if you're getting a puppy or a kitten, you might not know what they turn into, or what baggage they bring with them when you get them, even as such a young puppy or kitten. So sometimes personality and temperament don't establish until much later, and behavior problems are really prone to sort of showing themselves in that sort of adolescent stage, so somewhere between 6 and 36 months of age. So that's the one thing. So I personally have always adopted older animals because I can see their behavior. I can see their behavioral makeup. I can see their behavioral tendencies. And I might know a little bit more what I'm getting, even though I don't have some of that early life history. Having said that, of course, a lot of abandoned or stray animals maybe that are then adopted bring a whole other set of problems with them. So they may have been exposed to trauma, and that can be something that they then also bring with them. So it's difficult to answer for sure. It depends a little bit. So my husband, for example, he always says he wants a puppy because he wants to, see them growing up. He wants that bond. He wants to have influence on them during that early life. Whereas I'm always like, no, let's get, an older pet, because they also really need a great home. And our dog Lexi, for example, who we have now, we adopted her when she was 6, and we really knew what we were getting in terms of her sort of behavioral traits and her behavioral makeup.
So you have how many pets yourself?
At the moment, just 2, 1 dog and 1 cat, although we did have 4. We lost a couple over the last few years. But yeah, 1 dog and 1 cat at the moment.
How did they get along?
Great.
And they came together when they were both older?
So we got the little cat, whose name is Lizzie. We got her as a kitten, and we already had Lexi at the time. In fact, we had 2 dogs and 1 cat at the time. So she came into the home when she was a tiny kitten. Both of the dogs were older. The other cat we got when she was a kitten. So yeah, it's a little bit of a, kind of complex story, because some animals are already there when the others come in. But our 4 got on really, really well. And that isn't always the case. That was a lot of it was luck, individual personality traits, individual temperament, how open those animals were to accepting other animals into their homes. And we actually recently had a bit of a foster fail. We did want to bring another cat into our home, and that didn't work because cats can sometimes be quite challenged around, especially living in the same environment with another cat. So even for me, it doesn't always work out, and you have to really kind of approach that, I guess, thinking about each individual animal's needs and are they going to be happy and are they going to be able to cope with everyone else in the home as well?
All right. So from a practical standpoint, it brings up an interesting question, which is, what do you do when, first of all, how do you recognize, despite the best efforts, you're not going to be able to change, for lack of a better expression, the personality of the incoming cat? And how do you then realize this isn't going to work? And how do you pivot and I guess try to find a new home for the cat?
Yeah. What's the plan B? Absolutely. Yes. So, and these are the most common cases I see here in the UAE. So I'm quite lucky in that I see a lot of feline cases. Not lucky because obviously we don't want cats with behavior problems, but a lot of my colleagues don't get to see as many cats as I do. But the most common behavioral problem here in the UAE amongst cats is intercat aggression. So that's that whole scenario of, multiple cats living in one home. Sometimes it can just be two, sometimes maybe more. And there are frequent fights, frequent sort of tense events, frequent aggressive events, and it becomes really stressful to the point where those cats then get separated and one cat has to live in one room and the other cat lives in the other room. So I think the thing that helps you recognize that it's not going to work is the severity and the intensity of those hostile events. So if you have cats that can kind of coexist with each other, there might be a little bit of tension around resources. So that's food, water, litter boxes. You can often, with management, make that a livable situation. If you have two cats that as soon as they see each other or as soon as one sees the other, there is an active fight. So that's one cat, chasing, pouncing on, maybe injuring the other cat. That becomes a situation from a welfare perspective that's just not feasible for anyone. So, and they're tough conversations to have because, by this time owners are attached to all of the cats. They want to keep all of the cats. They want everyone to get along. So having that conversation that cats in particular can really struggle to get on with other cats, that can be the first part. And then, yeah, absolutely, we move to that kind of conversation around the plan B. So is there another option? Is there a family member that can maybe take the other cat? Oftentimes we've ended up sending cats to family members overseas because that's been a good option. And sometimes, we try and find new homes for them. But they're tricky situations, and they're tricky because how do you find a really good home for that other animal? And B, it's that whole sort of emotional turmoil that the owners go through. Am I giving up on the cats? Am I abandoning them? Did we do something wrong? Surely there's got to be a way of solving this. And sometimes there just isn't. And that's down to cats, their genetic makeup and how they've evolved as a domestic species.
So we've spoken a lot about cats and dogs. Do you deal with other animals and their mental well-being?
Yeah, so horses is another big passion of mine. And horses is a really interesting topic because by bringing horses into a domestic environment, we're essentially taking away everything that they need as horses, especially here in the UAE. So horses, they need forage, friends, and freedom. Those are like the 3 Fs for horses. So they need to be out at pasture. They need to be moving. Horses spend around 60% of their time grazing and moving and grazing and moving. And in the climate of the UAE, that's not always possible, certainly in the hot weather. Friends, they need to have contact with other horses. So they need to be able to live in that sort of herd setting. And then freedom, they need to be able to, not be stuck in a stable for 23 hours of the day. So those are things that really pose challenges. And then as a result of not meeting those behavioral needs, we see repetitive behaviors. We call them compulsive behaviors or abnormal repetitive behaviors. So you'll see horses maybe weaving, like moving from side to side or pacing in their stalls, maybe becoming aggressive and showing those unwanted behaviors. So horses is a whole kind of topic in itself. I don't see a lot of horses, but I have seen a few. So horses. And then we also see birds and rabbits and those more exotic animals where, again, the husbandry piece, so how we actually keep them, can be really influential on their behavioral health as well. So parrots, the parrots that kind of pluck out their feathers because of a whole host of different reasons. That's a really common presentation as well.
And I'm amazed by this, you can help birds figure out, or you can help the owners of the birds figure out what it is that needs to be done so that they okay, give me, I'm very curious about this. Give me a scenario. Here, of course, hawks are a big thing, part of the culture in the UAE. Would you deal with hawks?
No, so they're a different kind of bird, I guess. So the birds of prey are different again. And I did see some practice during my residency with falcons in particular. But I guess falcons are pretty well kept, especially in this region. So we don't see as many behavior problems. I think much more we see parrots and the cetacine. So that would be parrots and maybe budgies and ringneck parakeets and all these sort of birds that are really very beautiful to look at and make great companions because they're so smart, they're so intelligent, they're so clever, but they have a really individual host of needs. So if you think about how they would live in a natural setting in the wild, right? They live in big flocks and they kind of fly and they move around a lot. And what we're doing is we're bringing them into the home and keeping them in cages and oftentimes without other birds. So there'll be a bird alone that then ends up very much bonding to the human, to their owner, and that can bring a whole host of problems with it. But yeah, I mean, we can figure out some of the things that are missing in that bird's life and we can try and optimize things to help them. But there's a very sort of big, I guess, thought process amongst vets in general, especially vets that work with birds a lot, that we shouldn't actually be keeping birds as pets, that it's ethically not correct to do so.
So is that advice that you would, on occasion, pass along to some of your clients?
I mean, yes, we do sometimes have those ethical conversations. I guess it's difficult when that pet is already in the domestic setting and you kind of have to work with what you have. So I can't then kind of say to them, just release them, because sometimes their wings have been clipped or they've been hand-reared, they've been captive bred maybe. They're then not suitable to a life in the wild. But it's a bigger question than that, right? Like, should we be keeping birds in general as pets? Should we be captive breeding them? Should we be raising them as pets? And that conversation is sometimes difficult to have with the caregiver because they've now got that pet and they're expecting a solution for that particular animal that's maybe behaving in a way that they're struggling with. But it does pose a wider question. The ethics of it can be complex.
So we're in the UAE and we've both been here an awful long time. Mm-hmm. And in my industry, media, I could talk about how things have changed. Yep. But in your industry, have things changed an awful lot from when you first arrived? When it comes to, I'll be specific.
Yeah.
When it comes to, say, we spoke off camera about how back in the day, there were an awful lot of families that would come out, either adopt or somehow get themselves a family pet, mm-hmm. and then they would move back home, mm-hmm. and they would abandon the pet. Is that, for instance, still happening?
Yeah, unfortunately, that is
as
still
frequently?
I think so.
Really?
Yeah, I think so. Maybe actually even more frequently, because there are more pets, there are more expats who stay here transiently.
Yeah, I'm going to interrupt you again.
Sure.
Apologies, but so I remember as a journalist back in the day, there were times where it happened a lot, but then I thought it was going to change an awful lot when the UAE signed up for PETS, right? Which is an acronym. I think it's PETZ, if I'm not mistaken. It could be S, but it's essentially a global organization, it's a global entity that allows you to import your pet from one country to another, mm-hmm. so that the animal doesn't have to go through, 2 or 3 month quarantine period or 6 months. And yet that hasn't changed the situation.
So the problem with international relocation of pets is that it's expensive. And I think that's something that owners don't consider when they get a pet. It's an in-the-moment, emotional, emotive decision. Maybe they want the companionship. Maybe the family is looking for a pet. And then perhaps their circumstances change and they leave the UAE. And all of a sudden, if you're thinking about a large breed dog traveling to somewhere, let's say like Australia, New Zealand, maybe even Canada, all of a sudden they've got a 30,000, 40,000 dirham expense thing to deal with. Exactly. And that can be a struggle. So even though the quarantine restrictions in some countries are reduced, there is still quarantine in Australia, there's still quarantine in New Zealand, Singapore, South Africa, many other countries. So it hasn't completely alleviated that. Even the US now is quite difficult to kind of relocate pets to. So I think it's still happening. And, you know, I know that because a lot of the Facebook groups that are very active and vibrant in the UAE are often posting, you know, about abandoned pets where the caregivers have just left the country and abandoned those pets. So yeah, so some things have changed, but some things also haven't. And I think that's just a result of where we live, this sort of the transience of the UAE, although, you know, I absolutely love the UAE and we've both been here for a long, long time. That's not the case for everybody. And those challenges do still exist.
It surprises me because, yes, the UAE is transitory. That's certainly the reputation that it has. But I do think it's changing an awful lot. And you can disagree with me if you think that I'm missing something. But because of the golden visa opportunities and because of the opportunity to also own property, I kind of would have thought that more people were here and settled, staying for longer periods of time. And because they were doing that, they were also maybe making other well-informed decisions. You know, to buy a house is not something that you go into, you know, with just emotion, right? But when we're talking about pets, and this is something that I've always had an interesting sort of debate within myself. And there have been some very famous lines through movies where you don't need a license, for instance, to get pregnant. You don't need a license to do a lot of things. Should there be a license required for people to become pet owners?
Ooh, interesting question. A bit controversial. I mean, I think yes, because we just know that there's so much to know when you're living with a pet. So much from their physical health care over their kind of behavioral health care, you know, meeting their needs, making sure they have a life worth living. So again, that's a bit of an ethical debate there. So, I mean, I would say yes. However, we also know that pets bring so much to people's lives. We know that they are really important for the emotional health of people. And again, there's that ethical debate. Well, you know, who's more important and what's more important, the mental and emotional health of that person or that animal that's helping to support that mental and emotional health? And is the animal's mental and emotional health suffering as they do so? So, I mean, yeah, I would love to see something like that, or at least some kind of a basic education piece for people that do get a pet. And a lot of people end up doing that themselves, right? They get a pet and they feel very responsible and they, you know, they do get education around that. But then also a lot of people don't. And a lot of people get pets also for the wrong reasons because they think they can breed them and they can make money from that easily and quickly. So yeah, it's an interesting question. I'm not sure I have the complete answer to it. If it were up to me, I would say there should be some kind of a basic minimum requirement for being able to live with a pet and share your home with a pet. But how enforceable that is and how practical that is, not sure.
I do think that, you know, nobody's going to stop you from getting a license for your car, but you do have to go through some training. And I think it should be something that is similar to that, where yes, you can have a pet, but you have to go through, you know, a 16-hour sort of training program to figure out what it is that you should be doing. I know my daughter back in Canada has a dog now, and she was determined that from day one she was going to train the animal. And that to me has helped create a healthier relationship. Yep. Do you think that having those structured training sessions with domesticated animals are a good thing?
Depends on the trainer. So we have a lot of different trainers out there, and many of the sort of, I guess, more traditionalist, old-fashioned type trainers unfortunately still use what we call aversive methods, so punishment-based methods, you know, the whole idea around dominance theory or pack theory, you know, I need to be the alpha, all that sort of thing, which we know now and has been proven time and time again is really detrimental to most of the pets that we live with. So no, in that case. However, if you're perhaps doing training that's, you know, positive reinforcement based and that really also incorporates understanding that pet and understanding their mental and emotional health and what emotions they can and can't experience, then absolutely, that's a great way of building a really strong relationship. Because I think at the end of the day, if we're living with a pet, we want that relationship. That's what it's all about. And so to have something that improves that relationship is great, but to have something that jeopardizes that relationship or confuses the dog because they want to be socially bonded to you, but now you're also punishing them for certain things, I think that can be challenging to the pet, because whilst absolutely they're sentient beings, there's perhaps a cognitive piece, or, whereby you can maybe explain why you're using a certain approach to a person. You can't explain that to the animal. And you can cause a lot of damage if you're using some of these really heavy-handed approaches, shock collars, prong collars, you name it, all those horrible things out there.
So you mentioned dog, and I grew up with dogs. We had a Siberian Husky here before we shipped him home with the kids to Canada so he can enjoy the snow. Can you train a cat, though? I've never had cats, so I can't say.
Yeah.
But can you?
Yeah, you
Really?
absolutely can. Yeah.
To be as obedient as a dog?
And here we enter into another ethical debate.
Because then I would, from what I've seen on social media, then there would be people that would say, yeah, but then there are the orange cats.
The spicy ones.
Yes. So can you train a cat?
You can absolutely train a cat, because every mammal brain is the same in terms of learning theory and how that brain learns. So you absolutely can train cats. Now, you probably want to have a think about what are some of the things that you want to train them to do. What are going to be things that are going to be really valuable to you and them in everyday life? So maybe training them to go into a cat carrier and to love being in the cat carrier, because you are going to need to take them to the vet, regularly. Or maybe teaching them a recall if they go outdoors and you want to call them back in again. So absolutely, you can train cats. People, if you only need to look on the internet, people train cats to do high fives and tricks and sit and roll over and all the things that you can do with dogs. But you did mention something there that I want to touch on, and that is, should we be training for obedience? Is obedience the right thing that we want to be teaching our animals? Or do we want to be teaching them how to cope with our modern world and how to cope with living in a busy domestic setting that might be an urban setting, for example, where there are lots of things, triggers that could potentially not threaten them, but that they could feel threatened by. So for me, rather than obedience, it's much more about teaching them resilience, coping skills, how to fit into our lives and live in our busy worlds. I think that whole idea around obedience, we're moving away from that. So it doesn't serve many dogs well to be able to sit on command. Sometimes, yes, it can, but what are we actually achieving with that? So that's a whole nother debate again.
So when our children were here, they were 7 when we moved to the UAE, and about a year later we ended up getting a dog. And we got a Siberian Husky. Now, this was not one that we had imported. It was one that was already in the country. And it was just a puppy, and we were fortunate enough to adopt it. A fantastic part of the family, stayed with us for 14 years or so. But how do you feel about, should we all, if we want a dog, only have Salukis here? Or how do you feel about non-native species pets in the house? Because it can be, it gets very hot in the summer. And even when it's hot in the summer, is the AC a good environment for a pet to be in for 4 or 5 or 6 months out of the year, aside from the occasional walk? What are your thoughts?
It's a really good question. And I'm not sure I've got the perfect yes or no answer for it. I think whenever we choose a pet to join our family, there are so many questions, not just around, I guess, the environment, although that's a big part. And look, we're in the UAE and we have what we have in terms of the dogs that we have available here. Should we all just have Salukis? Maybe, maybe not. Maybe the Salukis are able to adjust to the heat and the environment, but they're a hound. They love to run, they love to chase, they love to do all those sorts of things. So that aspect of a Saluki's behavior might not be suitable, let's say, for apartment living, for example. So while it depends on the environment and maybe the climate and the country that you're in, it also depends a lot on what is their everyday going to look like? Where do they actually live? Do they live in a large villa with a big garden where, maybe that's their environment and they never ever have to leave that home? Or are they in an apartment where they're going to need to leave the apartment 3, 4, 5, 6 times a day to toilet and to kind of get out of that space? Can that pet then cope with that outdoor urban environment with kids and bikes and noises and construction and all that sort of thing? And also, what are you looking for from a pet? Is it purely a companion? Do you want to go on long hikes with them in the winter here, for example? Do you want to do some scent work or nose work? Do you want a dog that's really great at using their noses? So there are so many things to consider. And I think it's not just the climate and the environment. There are a million other things as well that I think fall into that. And I wish more people would do sort of pre-purchase consultations with a vet or with somebody like myself to really go through those questions and figure out, what do you actually want from your dog, and can your dog meet up to those expectations, and maybe, move away from a designer breed or something that you think looks cute.
Yeah, I think that if you have an open mind, for instance, when you're going to buy a car, you're going to go and maybe speak to a few dealers, and you're going to say, I'm looking for a car that can do this and this. I've got a large family, or I've got pets, or I'm going to be doing a lot of highway driving, and you do your research. I don't know that same thought goes into getting a pet, right? There, as you said earlier, there is an emotional reaction.
Absolutely.
And that's like, oh, I want that.
Yeah.
But you had said, I had talked about our dog, Bauer, being part of the family, and you had also mentioned that as well. Do you think in the UAE, because we are fortunate enough to have such great healthcare, do you think we ever get to the point where people who do or don't have children, not that should necessarily have a role in it, but where maybe they are sponsoring their pet and the pet also becomes part of the healthcare plan? Mm-hmm. Do you think first of all, is anyone in the world doing that?
I have no idea. It's a great idea.
and do you think that the UAE ever gets to that point?
So I have never heard of that before. So I'm not sure that anyone in the world is doing that. Although, it's a really interesting idea. Yeah. The UAE has been a little bit slow to provide really great pet healthcare insurance. So I've been working here in the UAE as a vet for almost 20 years. And only in the last year have we got a pet insurance company that actually matches up to some of the insurance companies that are available overseas in Europe, the UK, in sort of those countries. And I don't know why it's taken them so long to get to that place. But knowing the UAE and how progressive the UAE is and how forward-thinking they are, perhaps that is something that is, something for the future. But I think that's been one of the big struggles here in the UAE, is not having a really great pet insurance company. Hopefully that's changing. And so something that, for example, my clinic has done, we've actually created things to help pet owners out a little bit. Something like our Pet Health Club, for example, which is an annual membership plan that gives percentages off some of the routine healthcare, vaccines, parasite control, dentistry, food and merchandise, that sort of thing. And then we have, like I say, one promising pet insurance provider that's come into the market in the last couple of years. So that helps. But I love your idea. That sounds great.
Do you think over the time that you've been here that there has been a greater welcoming of domesticated animals? Because traditionally in this part of the world, cats would be okay. Mm-hmm. Whereas dogs, you can still see that with some cultures, there's a skittishness on the part of the person when they come across a dog. Yeah. And the dog doesn't necessarily have to be aggressive.
Right.
But have you seen that here in this country that things have maybe changed a little bit?
Again, yes and no. I think there's definitely more openness around especially dogs. I think, as perhaps Emirati locals have gone overseas to be educated overseas and have seen how dogs fit into the lives and families of other sort of cultures, I think the openness has grown. But only recently I actually got somebody contacting me to say, we helped somebody out that left the country. They had to leave their Staffordshire Bull Terrier behind because it was an old dog. They were traveling back to Australia and they couldn't take the dog with them. So this lovely family's taken on this dog, and now the neighbours are asking for that dog to always be muzzled whenever the dog is taken outside because they're fearful of the dog. And yet this dog is the most lovely, placid, wonderful dog. is 14 years old, probably doesn't pose a huge risk to anybody, but there's still that kind of cultural fear around, oh, I'm not sure how that dog might respond or react. So I think yes and no. I think there's definitely been some progress, but I think there are still, challenges around that.
And some of the urban myths that we would have come across in the time that we've been here, some of the exotic animals that would have been kept. Mm-hmm. Can you tell us about some of the more exotic animals that you might have treated over the years?
Yeah. So when I first came to the UAE, I hadn't opened my own practice yet. I was working at a different practice, and I was asked to treat a cheetah, and we regularly had primates, so small monkeys, and I even got asked to treat a wallaby. At one point, the wallaby just kind of hopped into the waiting area, and that I personally find that challenging. I found that very challenging. And when I opened my own practice, that was something that I knew right from the start I wouldn't be treating exotic pets. So yeah, I have. I guess now probably the most exotic pets that we see would be birds and, some of what we call small furries. So maybe some rabbits and hamsters. We've seen the odd sugar glider and maybe turtles. And again, I find it quite challenging because oftentimes the environment and the husbandry for those animals isn't great. But yeah, no, I have come face to face with some big cats and some primates, yeah.
So now you just say for your own practice, we don't treat them.
Correct.
And do you think that there are still quite a number out there?
Yeah.
In Abu Dhabi and Dubai?
Yes.
And which brings up another interesting question from my point of view. We both live in Abu Dhabi. I think we both prefer Abu Dhabi. I don't want to put words in your mouth.
No, I agree.
But are there differences between some of the challenges that pet owners have in one emirate compared to the other?
I don't think so. I think in terms of kind of the healthcare that's provided, it's pretty similar across both of those emirates. Dubai is always said to be a little bit kind of the flashier emirate, so maybe there are a few more exotics, although maybe this is more correct. Maybe there are a few more exotics on parade or on display. I mean, we all know of the stories where, there are monkeys and big cats, being driven around in very expensive cars and paraded outside of hotels. I haven't seen that or heard that in Abu Dhabi, if I'm honest. That doesn't mean to say that those animals don't exist in Abu Dhabi, but maybe they're just not on show as much.
I think there's a certain social media presence that exists in Dubai, and I'm only going by anecdotal evidence for this, that maybe doesn't exist quite to the same level in Abu Dhabi.
Yeah.
Where there is a showiness, I think, in Dubai that is not quite as prevalent as it is in Abu Dhabi. Another question I wanted to ask, throughout your time working here, are there some standout cases that have really stuck with you where it was either a really bad situation or it was just such a unique situation because it was the complete opposite of something that was bad?
Yeah. The opposite of something that was
yes,
bad.
Good or bad.
Good or bad. So, there are many. There are a couple that immediately come to mind. So I remember this was probably, quite a few years ago now. I can't say exactly how many, although a Facebook memory did recently pop up about this. But we were contacted by a rescue group that had, saved, or I don't know what the right word is, something like, I think it was 38 breeding cats that had all been hoarded in a very small apartment and that were being used for breeding purposes. And I think this rescue group was able to go in and kind of take these cats, confiscate, I think maybe is the right word, these cats. And it was a Sunday. So back in the day, I think it was a Saturday. So it was a weekend day. It was myself on my own working with 2 nurses in the clinic. And these 38 cats all came to the clinic and all needed to be triaged and treated and looked at. And I remember the 3 of us working probably, I can't remember, until midnight or something like that to evaluate all of these 38 cats that were in various stages of health. Some of them were really unwell. Some of them were fine and just needed, a little bit of TLC and looking after. But I think that was one of the most both rewarding but also distressing situations that I was in. Rewarding because all of those cats ended up going to great homes. We heard about so many of them afterwards. and being able to sort of liberate them from that situation that they were in was really rewarding, but also a little bit disturbing and distressing, because you thought, gosh, how many more are there out there like this? And what was their experience of life like for that, period of time that they spent in that environment? So that was quite an interesting one. So that was a standout. And then I think I've had one standout case recently that is more related to my veterinary behaviour work, the veterinary psychiatry work, which was a dog that was one of the most anxious dogs I think I've ever seen, to the point where the dog just didn't know what to do with themselves. And the poor owner, caregiver, was sleeping with the dog on the sofa, wasn't getting any sleep herself, and was really struggling to deal with the situation. And we were able to turn that situation around really quite quickly, with the help of use of psychopharmaceutical medication. So medication to help to relieve some of that anxiety and that distress. And we had such a quick, really positive outcome. And that doesn't always happen, not in other physical cases, nor in veterinary psychiatry cases. But that was such a big case where I thought, wow, I was really able to make a difference here. And I was able to help not just the dog, but also the caregiver. She had been sleeping on the sofa for a long time, and she was actually able to sleep in her own bed again after 2 weeks. So those are the cases that stick with you. And then, of course, there are so many others. I mean, over 20 years, imagine how many animals cross your path. They all leave a special place. And one of the things I think personally that I see as the biggest privilege to be able to do is to be there for euthanasia situations where you're able to provide a really peaceful and dignified ending for a pet and that family where that life has just naturally come to an end. And those are the cases, again, that stay with you, that you remember, that you receive the most chocolates and flowers for. And, that I just think, wow, that's a real privilege to be able to do that.
Yeah. I look back on when our dog died, for our kids in particular, because we had the dog from, I guess they were 8 until into their late 20s.
Yeah.
And it was a big moment for them. And I am grateful. The last 6 months, the dog was wearing a diaper, and it wasn't the best situation, and he wasn't as mobile. And you could just tell he had lost his spark. And I think that to be in that situation, I think it was a moment for the kids that, they only look back on the time with the dog as a wonderful experience rather than that last moment, because the last moment gave them that opportunity to say goodbye, as you say, in a humane and a respectful way. And I think it's a moment that will stay with the kids for a long time. But Dr. Katrin, thank you so much for joining me. This has been incredibly interesting. I appreciate it.
My pleasure. Thank you so much.